is Trayvon. I'm going to be the nurse today. Here to do a postpartum assessment. Before we get started, provide privacy and wash my hands. Alright, and I just have to get you verified. Can you verify your full name and date of birth, please?
Cheyenne Price, 01/31/97.
Perfect. Alright, and I would move the bed up to a appropriate working height if the couch moves, but it doesn't move. And also, just for the record, the med surge assessment has already been completed and no abnormalities were found. So we're good on that. And so we're just gonna assess you a little bit here. Pretty much moving from the top to the bottom. First we have to start with your breasts. Okay. I'll cover you a little bit. Cover you back. Alright, we're gonna assess the breast. They should be soft, filling, and they are not tender or any inconsistent lumps or anything noted. Assess the areolas or in the nipples. They're not dry or cracked or bleeding or any leakage there. You would teach the mother at this point that if she's gonna breastfeed, she should be wearing a supportive bra, and if she's not gonna be breastfeeding, she should be wearing more like a tight-fitting sports bra. All right, and we're gonna move down, assessing the abdomen. No C-section incisions noted. She was a vaginal birth. She's 2 days postpartum. Let's see, no redness or swelling or anything noted. We're gonna listen to bowel sounds on 4 quadrants. Alright, bowel sounds are active in all 4 quadrants. Alright, and at this point you would palpate the fundus. Before you would palpate the fundus, you would support the uterus and you would palpate the fundus, and she should be 2 finger lengths below the umbilicus, and she's about that. All right, I'm gonna cover up back here, and we're gonna move downward, and she's gonna have a lochia pad or pad here with lochia on it. It should be moderate to, I guess, heavy lochia, and it would be rubra or dark red. At this point, you would teach her about the lochia. Lochia would move from lochia to serosa, which would be a dark red color to a pinkish brownish color, and then we'll move to alba, which will be from a pinkish brownish color to about a yellowish whitish color. Also, you would just assess her lower extremities, noting any edema or swelling or redness or anything abnormal down here. No abnormalities found here. You would assess the popliteal pulses. And those are strong bilaterally. You would also assess the posterior tibial pulses which are also strong and bilateral, and the pedal pulses, which are strong bilateral. Okay. I would have, after I would have been in the perineal area, I would have changed my gloves and washed my hands. Okay. You would assess when if the woman would have actually had a bowel movement. Have you had a bowel movement?
Not since yesterday.
Was it yesterday? Okay. And was it normal?
Yes.
Okay. And let's see. I'm gonna turn you on your back. Here we'll just assess the we'll be assessing to make sure the spinal incision, or if she had an epidural, the spinal site isn't red or edematous or any drainage or leakage is there. If she also had episiotomy, you would also assess the episiotomy site and any hemorrhoids that would be, if they were there, note. You would note them by piece and by size. Okay, you turn that back. Okay. After that, you would pretty much wraps up the assessment. You would wrap it up with teaching points, and you would start with car seat. So do you have a car seat for the new little one?
Yes.
Is it brand new?
Yes.
Okay, if it wasn't brand new, you would just reassure it's not expired, hasn't been in a car accident. So let's see. Oh, okay. So I also need to teach you about rest and putting the baby back to sleep. She should be on her back in the crib, no stuffed animals, no blankets, no pillows, anything like that. And shaking baby syndrome or unaccidental harm. If you find yourself getting frustrated or irritable, I'm not sure what the home situation's like, but if dad's there, friend, family, or she can simply cry in her crib. That doesn't hurt. Also, you should 3 tips or 3 indicators to give your primary healthcare provider a call would be, for your infant, would be fever, of course, anything over 100.4. If she refuses 2 consecutive meals, or if she has 2 green watery stools. Okay. And for you, also, if you have a fever over 100.4, you want to give your healthcare provider a call. Also, you want to give your healthcare provider a call if your rubra, or if your lochia goes from serosa back to rubra, or alba back to rubra, if it goes in the reverse order. Also, if you would also give your healthcare provider if you have persistent abdominal or perineal pain. So those would be that's actually indicative to give your healthcare provider a call. Now, do you have any other questions for me?
No.
No. All right. I think we're done.
All right. Thank you.